How can Van Halen and Brown M&Ms help you pick the best surgeon for a total hip or knee replacement? Give me 5 minutes and I'm going to show you how one single question can help you avoid an ugly scar, reduce your chance of infection, and help you pick the best surgeon for your total hip or knee replacement. If you'd like to know more about what you can do both before and after a total hip or knee replacement to get the best possible results, let me know in the comments below and I'll send you a link to our free total joint workshop and our surgeon questionnaire. I'm Brad Logan, founder of Total Joint PT, and I'm your physical therapy specialist for total hip and knee replacement. I have successfully helped thousands of people rehab their new joint after surgery. In every video, I'm going to give you one tip or strategy that you can use to get the best possible results after surgery. Back in 1982, when Van Halen toured the country, they had a seemingly ridiculous contract demand. Their contract was really complicated and had several specific demands regarding the light show and stage setup at the venue they were playing. Right in the middle of their contract, they made one notoriously famous request: M&Ms, warning, no brown ones. On the surface, it just seems like a ridiculous demand from a narcissistic rock band, but it actually had a deeper purpose. When the band members and the road manager walked into the dressing room and found a bowl of M&Ms with all the brown ones removed, they felt confident that the other, significantly more important aspects of their contract had been fulfilled because they knew immediately their contract had been read thoroughly. If they walked in and didn't find a bowl of M&Ms with all the brown ones removed, they canceled the show because they were concerned about the safety of the setup. So what does this have to do with the total joint replacement? Well, there's several different ways to close a surgical incision for a total hip or knee replacement. Some surgeons use sutures both internally and externally, while some use a combination of sutures and adhesives. But some surgeons still routinely use staples, which is an older, more crude technique to close a surgical incision for a total hip or knee replacement. Staples are my brown M&Ms when it comes to a total joint replacement. To me, staples are an antiquated, old-school practice by a surgeon that just does what they have always done because they think it works fine, and they're not evolving with more effective methods, techniques, or innovations. I have listed on my questionnaire for surgeons whether they use staples, sutures, or adhesives to close the incision. If they use staples, that would be a red flag for me to dig deeper into their overall process. Staples are appropriate for difficult-to-close, traumatic lacerations in most cases, not for controlled, clean surgical incisions. Unless there's special circumstances, staples are a lazy, sloppy way to close a hip or a knee. It bunches the tissue together, leaving the potential for an ugly scar, and it can result in more adhesions to the underlying tissue, and it has a higher rate of infection, according to the research. If they're using staples, I wonder if they were equally lax on their overall technique, including the subdermal incisions, clean sutures of the muscles and connective tissue, placement and alignment of the hardware, cleaning up the edges of the bone meticulously, the overall desire for a perfect surgical hip or knee on the inside, or if they just want to get it good enough. I would seriously consider choosing a different surgeon if they use staples. It's a bowl full of brown M&Ms. Choosing the best surgeon is just one of the major decisions you need to make as an active participant in your total joint replacement journey. If you'd like to know more about what you can do both before and after a total hip or knee replacement to get the best possible results, let me know in the comments below and I'll send you a link to our free total joint workshop. It's about 20 minutes long and it will give you some great information on how to prepare for surgery and how to rehab your new joint after surgery to get the best results. I'll also send you a link to our free surgeon questionnaire. It's a great tool to evaluate whether or not the surgeon is right for you.